Where am I?
Hello. I have summoned you, Walt. I have questions for you on lung cancer. But before that, we need to talk about the cell cycle. In this part of interphase, called G1, the cell grows. And in the second phase of interphase, the S phase, the cell replicates its DNA. The third, and final part of interphase, the G2 phase, the cell grows even bigger in preparation for mitosis.
That's all well and good, but what does it have to do with cancer?
I'm not finished. In the cell cycle, there are things called checkpoints. These checkpoints are to see if the cell is doing what it's supposed to do. For example, the G1 checkpoint, it is checking if the cell is growing correctly, is the DNA damaged, etc. You wouldn't want the DNA damaged because, in the next stage, synthesis, the DNA would be copied. This would cause problems later on during mitosis. The checkpoint in G2 sees if the DNA was copied correctly. This checkpoint also checks if the cell is growing enough, and has the resources it needs to continue. The final checkpoint, in mitosis, checks if the chromosomes are aligned correctly for when the cell splits. If the cell fails one of these checkpoints, then it is put on hold till it is fixed. But if it can't be fixed, it self-destructs. This is called apoptosis. Cancer happens when a cell divides too much. This is because they don't follow the cell cycle. Cancer can be caused by genetics, overexposure to toxins, radiation and UV sunlight. For example, Walt Disney smoked since he was a young adult. In November of 1966, he was diagnosed with cancer. And on November 30th he had been admitted to the St. Joseph Hospital. Then on December 15th, he had died of circulatory collapse caused by his lung cancer. Walt Disney's death hit the world by storm, but if he lived in 2019, he may have discovered his cancer sooner. It wasn't known then, but common symptoms of lung cancer are coughing, shortness of breath, bone pain, headaches, chest pain, and even coughing blood. Some ways Disney could have treated his cancer include chemotherapy, immunotherapy, targeted drug therapy, and many other types of treatment. While these treatments can prove to be effective, they also have their drawbacks, such as a weakened immune system, which is common in chemotherapy patients. But if Walt didn't even smoke, to begin with, he may have not even gotten cancer in the first place.